Hey guys, John Adams, the Rehab and Documentation Guru, doing a follow-up video to yesterday where I talked about metabolic syndrome. And I did a case opening this morning. I like doing case openings. I like setting things up, problem solving. Basically, I like telling people what to do. Just, set up everything and just say, this is what needs to be done, go from there. So I had a patient. Without revealing any HIPAA-violating issues or things about the patient, he's in his 70s. He's a very active man. He just had a joint replacement, hip replacement. And he has some things going on from a past medical history perspective. He's got a history of high blood pressure. He's got a history of hypercholesteremia, high cholesterol level. And I found out after I started doing his physical assessment, a couple other things. He had a slightly irregular heart rate. And I always, when I have patients with irregular heart rate and also what potentially could be metabolic syndrome, is I warn them about what atrial fibrillation or other heart irregularities can do in terms of like stroke risk. And when I shared that with them, all of a sudden the patient and his wife looked at each other and went, maybe that's what happened. Apparently he had a remote history of a CVA, small one, which I got to remember to put in his past medical history. I forgot to ask him side. I suspect a side, but he was really pretty good. And anyway, generally in great shape, but at risk. Not a very big man. But remember, I covered the 40-inch circumference waist or more for a man, and he was probably about that, right about that, but otherwise thin. And one of the things that you may have heard if you've done any reading or seen more recent news about risk is the whole phenomenon known as being skinny fat. In other words, you look skinny, but your internal organs actually have a lot of fatty deposits within them. So just because somebody doesn't have a big gut, you might look at them and say, well, they're not obese. Yet they might have a lot of problems with adipose in the wrong area. And that's the main issue. So anyway, one of the risk factors, but back to this particular patient, when you have an irregular heartbeat, we know you could be more at risk for throwing a clot and ending up with embolic stroke. This guy, because of his inherent risk factors of previous stroke, because he's got the high blood pressure, because he's got high cholesterol, because he looks like he's got a waist circumference a little bit big, and he falls into a ethnic demographic that has higher risk for diabetes. And because diabetes, if you have diabetes or pre-diabetes, you are at higher risk for unstable plaque formation in your arteries, meaning that the plaque formation in the artery of a patient that's not metabolically unstable is generally okay. But the plaque formation in somebody that's metabolically impaired, like somebody with diabetes, is much greater. And so you have a much greater risk for embolus. I haven't had to say that word in a while. So anyway, I informed him of the risk, and then I encouraged him, though, because he was in otherwise great shape, but just to get it checked out. So make sure you're screening your patients for that. A heart rate, even if you have an orthopedic patient and they're a bit older, and they have a history of things that may point to metabolic issues, take the heart rate. Take it before and during activity. Make sure you're thorough in your assessment, because you may pick up on something that nobody else has picked up on, and you may, in turn, end up saving not just their quality of life, but their life. John Adamson, the Rehab and Documentation Guru, wishing you a happy day. Take care and God bless.